Every year in the United States, nearly 800,000 people suffer a stroke, and 3 out of 4 of those events happen in adults over the age of 65. Here is what alarms me most as a clinician. In up to 85% of cases, the body gives off warning signs hours or even days before the stroke strikes. Yet too many older adults brush them aside with casual explanations, like it is just stress. I did not sleep well. Or I stood up too fast. That hesitation is costly. Only about 1 in 10 stroke patients reaches the hospital in time to receive a life-saving clot-busting treatment. Take Edward, a retired teacher in his early 70s. His left fingers tingled in the morning. His speech slurred at lunch. He blamed dehydration. That night, he collapsed in the kitchen. The truth is, that stroke does not always begin with a dramatic fall. It often whispers first. A tingle in the hand. A sentence that will not come out right. A brief wave of dizziness that fades just as quickly. Research from leading neurological institutes shows that most seniors who suffer a minor stroke or a transient ischemic attack had at least one early warning symptom they dismissed. The hopeful news is simple and powerful. When you recognize these early signs and act quickly, the chance of a full recovery rises dramatically. In the next sections, I will walk you through 7 early warning signs your body may be on the verge of a stroke. I will show you what each sign looks like in real life. What is happening inside the brain? The evidence behind it. And the exact action to take the moment a symptom appears. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Remember this guiding truth. Time is brain. What you do in the first hour can mean the difference between walking away or never walking again. Sign 1. Sudden weakness or numbness on one side of the body. It often begins quietly. You reach for your coffee, but your fingers do not respond. Or your leg feels heavy as if it belongs to someone else. There is no pain, just an unmistakable sense that something is off. Many seniors think perhaps I slept on it funny. Yet that small, sudden change may be the first sign of a stroke. Inside your body, the explanation is straightforward and urgent. During an ischemic stroke, a clot blocks blood flow to a part of the brain. Because each hemisphere governs the opposite side of the body. Damage on the right can weaken the left arm and leg, and damage on the left can weaken the right side. That is why the fork drops from one hand. The knee buckles on one side, or one corner of the mouth droops when you try to smile. Deprived of oxygen and glucose. Brain cells begin to die within minutes. The longer you wait, the more tissue is lost, and the more function vanishes with it. Clinical data consistently show that sudden one-sided weakness or numbness is the most common early symptom reported by stroke patients. Older adults are especially vulnerable to misreading it because stroke-related weakness is often painless. A real-life example brings this home. Claire, a woman in her mid-70s, woke with a tingling left foot and shrugged it off as the morning chill. An hour later, she dropped her spoon at breakfast because her left hand went weak. Her husband had learned the fast check, so he asked her to smile and raise both arms. One arm sagged. He called emergency services immediately. Claire received treatment within the golden window and made a full recovery from what could have become a life-altering stroke. Here's what to do. If you or someone you love suddenly feels weakness in one arm or leg, numbness on one side of the face, or cannot lift both arms evenly, do not wait, do not guess, and do not drive yourself. Call emergency services right away, even if the weakness fades after a few minutes. Brief improvement can mean a transient ischemic attack, which is a warning stroke that often precedes a major event. The rule that saves lives is simple. If it is sudden and one-sided, treat it like a stroke until a doctor proves otherwise. If this sign sounds familiar, wait until you hear about the sudden speech problems that so many families mistake for fatigue. Sign 2. Sudden trouble speaking or understanding speech. Imagine you are in the middle of a conversation and suddenly the words will not come out right. Or your spouse is talking to you. You can hear their voice, but the meaning does not land. You try to repeat a simple phrase, yet the sounds are slurred, jumbled, or oddly flat. For many stroke survivors, this was the first clear signal that something was seriously wrong. The sensation can be deeply unnerving. You know exactly what you want to say, but your mouth and brain refuse to cooperate. The mechanism behind this symptom lives in the brain's language network. Most often in the left hemisphere, areas in the frontal and temporal lobes coordinate how you form words, understand sentences, and find names for everyday objects. When blood flow is cut off to those cells, even for a short period, the signals that produce clear speech scramble. That is why words can come out distorted, wrong, or not at all. And why understanding simple sentences suddenly feels like trying to decode a foreign language. Clinical research confirms that sudden speech disturbance is one of the most telling early signs of stroke. Emergency teams worldwide include speech in the fast check precisely because it is so time-sensitive. Outcomes data show that patients who receive medical care within the first few hours of speech onset are far more likely to avoid lasting disability. Consider Robert, a grandfather in his late 60s, who was telling a story to his granddaughter when his words began to slur. He laughed it off as being tired. His granddaughter remembered a school lesson on strokes, asked him to repeat a simple sentence, and heard it come out jumbled. She called emergency services without delay. Doctors confirmed an early ischemic stroke, delivered treatment within the critical window. And today, Robert reads aloud to his grandkids again. What should you watch for? Slurred pronunciation, swapping the wrong word without noticing, being unable to name familiar objects, difficulty understanding simple instructions, or a voice that suddenly does not sound like you. If a speech change arrives all at once and does not improve within minutes, call emergency services. Do not give food or drink. Since swallowing can be affected, time to treatment is everything. If this surprised you, the next sign often whispers even more quietly through your eyes. Sign 3. Sudden vision problems in one or both eyes. 1 minute you are reading the morning paper, and the next a chunk of text blurs or disappears. You glance at the television, and a dark curtain seems to drop over part of the screen. Some describe it as looking through a cracked mirror. Others say their eye feels fine, but the brain cannot make sense of what it sees, because it can vanish quickly and feels painless. This symptom is easy to dismiss. Do not. Sudden vision loss, especially in one eye, is a red flag for a stroke in progress. The biology is clear. Seeing requires a precise relay between the eyes, the optic nerves, and the visual cortex at the back of the brain. Strokes that affect the retina, the optic pathways, or the occipital lobes can abruptly interrupt that relay. In an ischemic event, a clot can block a tiny artery feeding the retina or the visual cortex. In a transient ischemic attack, a brief blockage can produce a temporary blind spot. In either case, your ability to process sight collapses without warning. Ophthalmology and neurology literature warn that a sudden, painless loss of vision in one eye may represent a retinal artery occlusion, sometimes called an eye stroke, and that a significant portion of those patients go on to suffer a full cerebral stroke within days if untreated. Seniors who report blurred, double, or tunneled vision are at markedly higher short-term risk. Lorraine, a 79-year-old baker, noticed her left eye dim for a minute while preparing cookies. It cleared, so she ignored it. The next day, it happened again, worse than before, and her daughter brought her to the emergency department. Testing showed a transient ischemic episode in the visual pathway. Because they acted, doctors prevented a larger stroke that could have struck within the week. What to look for? A sudden blind spot, graying, or dimming in one eye. Double vision, difficulty seeing to one side, so you bump into door frames. Or sudden trouble reading and focusing. These episodes may last only a few minutes and often do not hurt. That does not make them safe. Call emergency services if your vision changes suddenly, even if it returns to normal before help arrives. Think of it as the brain's flare gun. If your eyes are sending a warning, your brain needs urgent protection. The next sign often masquerades as ordinary dizziness, but it deserves the same urgency. Sign 4. Sudden dizziness, imbalance, or loss of coordination. You stand up from a chair and the room tilts. You take a few steps and feel wobbly, as if the floor shifted beneath your feet. You reach for a glass and misjudge the distance, your hand drifting past it. Many older adults chalk this up to fatigue or dehydration. Sometimes that is true. Too often, it is a stroke involving the back of the brain, where coordination and balance live. The cerebellum, tucked under the main hemispheres, fine-tunes movement, posture, and equilibrium. The brainstem links the brain to the body and controls essential functions like breathing and eye movements. When a clot or a bleed disrupts blood supply to these areas, your body's sense of orientation falters instantly. You may sway, stagger, or fall without a clear reason. You may feel intense vertigo as if you are spinning, even while sitting still. You may not be able to touch your index finger to your nose smoothly or slide your heel down your opposite shin without wobbling. Posterior strokes are notorious for being missed on first evaluation because their early symptoms overlap with inner ear disorders. That is why so many patients are sent home with vertigo, only to return later with a devastating stroke. Studies of cerebellar and brainstem strokes show that early imbalance symptoms are common and that delays in treatment double the odds of permanent disability. William, a gardener in his mid-70s, stood up after weeding and nearly toppled. He steadied himself and tried to walk, but his steps veered to one side and he reached for the wall. His wife wanted to wait. 20 minutes later, he could not place his foot accurately. At the hospital, imaging revealed a cerebellar stroke. Because he arrived within hours, intervention preserved function. And weeks later, he was walking with confidence. What to watch for? A sudden inability to walk straight. A feeling that the room is spinning. Trouble coordinating hands. Or dropping objects you normally handle easily. These symptoms warrant the same urgency as slurred speech or a drooping face. If they appear suddenly, do not test yourself at home. Call emergency services and remain seated or lying down to avoid falling. If unsteady balance can be an early sign, the next one can feel like a bolt from the blue. Sign 5. A sudden, severe headache unlike any you have felt before. It comes like lightning. One moment you feel fine, and the next, a blinding, crushing pain explodes inside your head. Some describe it as a thunderclap. Others as a pressure so intense it takes your breath away. Nausea or vomiting may follow. You may squint at the light or feel dizzy. Many headaches are not dangerous, but this kind is different. For many older adults, it is the only early sign of a hemorrhagic stroke. A bleed inside the brain. In a hemorrhagic stroke, a weakened vessel ruptures, allowing blood to leak into brain tissue or the space around the brain. That blood irritates and compresses the delicate neural structures while starving other regions of normal circulation. Blood pressure often rises sharply. Risk accelerates with uncontrolled hypertension, aneurysms, and certain blood-thinning medications, unlike ischemic strokes, which sometimes offer multiple small warnings. Hemorrhagic strokes often announce themselves with one unmistakable signal: a headache that is severe, sudden, and out of character. Neurology and emergency medicine research consistently report that the majority of seniors with hemorrhagic stroke describe the worst headache of their life at onset, and that each half hour of delay markedly increases the risk of death or profound disability. Consider Angela, in her early 70s, who had just finished a crossword when a stabbing pain erupted at the back of her head. She tried to lie down, thinking it was a migraine. Minutes later, her speech began to slur. Her daughter called emergency services, and imaging confirmed a small intracranial bleed. Because she arrived quickly, blood pressure control and close monitoring prevented expansion of the bleed. Angela went home without surgery and with her life. What to do? Treat a sudden severe headache as a neurological emergency, especially if you are over 60 or if it is accompanied by nausea, confusion, a stiff neck, vision changes, or neurological symptoms like weakness or speech problems. Do not drive yourself. Do not take pain pills and wait. Call emergency services immediately. Better to be told it is a benign headache than to ignore a bleed. If a bolt of pain can be a warning, the next sign is quieter but no less urgent. Sign 6. Sudden confusion or trouble understanding everyday situations. You walk into the kitchen and forget why you came. You stare at the coffee maker you have used for years and cannot recall the steps. Someone asks a simple question, and you pause, unable to find the right words. We all have occasional lapses. A stroke-related cognitive shift feels different. It is sudden, disorienting, and often paired with trouble following instructions, keeping track of time, or recognizing familiar places. When a stroke involves the frontal or parietal lobes, your brain's command center for planning, attention, and language falters. The result can be a fog that blankets clear thinking. You may understand that something is wrong, which can provoke anxiety, or you may seem oddly unaware, which can alarm loved ones. In right hemisphere strokes, judgment and awareness can change. So a person insists they are fine while missing obvious deficits. In older adults, especially those with mild memory issues, this sudden fog may be the only early sign. Clinicians see this pattern often. A spouse says she is not making sense today, or a daughter reports he suddenly forgot how to pay at the store. Henry, a retired postman in his mid-70s, was making coffee when he forgot how to operate the machine. His wife asked if he was all right. He looked at her blankly and asked where they were going, although they were at home. Within an hour, he could not recall their grandchildren's names. At the hospital, a small stroke in the frontal network was found because his wife recognized the change and acted fast. Henry's memory and focus returned over the next days. What should you watch for? Difficulty understanding familiar words. Trouble following a recipe you know well. Confusion about dates or places that are usually automatic. Or a sudden shift in behavior or personality that appears without stress or illness to explain it. If confusion arrives like a curtain, and especially if it pairs with other signs like weak limbs, slurred speech, or visual changes, call emergency services. Do not assume it is just aging. Sudden confusion is the brain's distress signal. If thinking can slip suddenly, movement can too. Which brings us to the seventh sign, sign 7. Sudden trouble walking or a new loss of coordination. You stand up and your foot drags. You try to cross the room and your stride is uneven or wide, as if you are walking on a moving dock. You reach for a glass and miss it. Or you fumble with buttons and zippers that you normally manage without a second thought. These moments are not simple clumsiness. When they arrive out of the blue, they often indicate a stroke affecting the motor pathways. Smooth walking and skilled hand movements depend on synchronized signals between the motor cortex, the cerebellum, and the brainstem. A clot in those circuits can scramble the timing instantly. The leg may not lift. The foot may scrape with each step. Or the arm may fail to reach precisely. Because many older adults live with arthritis or mild neuropathy, new gait problems are sometimes dismissed or misattributed. That is a dangerous mistake. Studies in aging neuroscience show that a sudden wider stance, slowed steps, or dragging a single foot is a frequent early sign in mild to moderate strokes, and that early falls often delay accurate diagnosis because families assume fatigue. Leon, an 80-year-old dog owner, felt his right foot dragging halfway down the block. He tried to turn back, stumbled into a fence, and his neighbor called for help. Imaging showed a small ischemic stroke in the motor region. Because help arrived quickly, therapy restored his stride, and he was walking without a cane within 2 weeks. What to watch for? A sudden change in your gait, dragging one foot, veering to one side, or feeling as if your legs will not obey. New clumsiness with hands, or repeated dropping of objects, and swaying while standing still. If these appear without explanation, treat them as a stroke until proven otherwise. Sit, stay safe, and call emergency services. Do not wait to see if it passes. In stroke care, a 10-minute decision can shape the next 10 years of your life. Doctor's final words. A stroke does not always begin with sirens and collapse. It often begins with whispers. And if you listen closely, you can hear them in time to change the ending. The 7 early signs we explored. One-sided weakness. Sudden trouble speaking. Sudden vision loss. Dizziness or imbalance. A thunderclap headache. Sudden confusion. And a new loss of coordination. May look small on their own. Yet together they form a clear message from your brain. And act now. Call for help. Protect what matters. The science is both sobering and hopeful. Most strokes are preventable, and most early warning signs offer a window for intervention. That window is not measured in days. It is measured in minutes. Your response can transform the outcome from lifelong disability to a full return to the life you love. Share this knowledge. Teach the fast check to your spouse, your children, your neighbors, and your caregivers. Place a note on the refrigerator that reads face, arms, speech, time. Build the habits that protect your brain. Steady blood pressure. Good sleep. Nourishing food. Daily movement. And a low threshold for calling for help when something feels wrong. Your body is not your enemy. It is your ally. And it has been sending you signals your entire life. Listen to it now. Trust it now. And act with courage. If this guide helped you, please click like, subscribe to stay informed, and turn on the bell so you never miss a health tip that could save a life. Type 1 in the comments if you learned something useful, or type 0 to tell me how I can make this even better for you. Thank you for being here. Stay safe, stay strong, and remember, you are never too old to listen to your body and to fight for your future.